This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it. This pain causes tightness, tingling, and weakness to the low back, buttocks, and down the legs. It is worse with standing and walking. It goes away when you sit or lay down. Over time, it becomes worse, making you become less active, occasionally requiring a cane or even a walker. What is causing your pain and how is it treated? These are common questions I hear in the clinic every day. I will address these concerns and discuss the specific diagnosis and treatment of this painful condition.
Your host, Dr. Carrasco.
This is Real Medicine. I'm Dr. Carrasco. Welcome to the show. Today we're talking about a condition that affects millions of people. We're talking about lumbar canal stenosis. Unfortunately, millions of people suffer from this condition. Either their son or their daughter or their husband brings them in because they're in severe pain. They are now feel depressed. They look depressed. They're not as active. They're not doing what they need to do with their family. They're not going to the store. Maybe they're not shopping. Maybe they're not going to church. It's really impacting their life. So we're going to show a video on a patient who came to see me who has this exact same condition. When did you start having pain at first?
Oh, it would have been probably around 2000.
Okay.
I ended up here. I was very discouraged about the amount of pain that I was having, and I had to stop walking.
What would you say your pain is?
Yes, that's where it is today.
What's important to me is how this is limiting you.
Yeah.
How far can you walk now?
After the pain became severe, I stopped walking. That was the stage I was at. That, okay, I've become useless. They won't have me anymore.
This is a real story. It's an emotional story because it really was impacting his life significantly. But a lot of people suffer like this. We'll see later on the show one of my former patients who had canal stenosis. She's a real smart, intelligent lady, but she was wearing a cane because she was having so much pain and discomfort. What happens is when people have pain, they just want to know what is causing my pain and how do you treat it. We'll talk about that today. How do you treat this condition? How do we improve your quality of life? But first of all, let's talk about what is it. This is called spinal canal stenosis. And what's happening, if we see the spine here, is that the spine itself is being narrowed. The spinal canal, the disc is here, the spinal cord is here. This area gets narrowed, gets pressure on the nerves, and causes quite a bit of pain and discomfort. What are the symptoms that we see? Generally, you have pain in your back, the buttocks going down the legs. The pain is worse when you stand, and then once you sit down, the pain gets better. I mean, what happens in these patients is that they get to where anywhere they go, they got to find a place to sit. If they sit down, the pain goes away. They stand up, walk the same distance, and the pain comes back. We see it almost all the patients. It can switch from side to side. Anything that narrows the spine can cause this kind of condition. So let's look at the spine and see what we're talking about. Let's get oriented a little bit. When we're talking about canal stenosis, we're talking about this part of the spine. This is the disc right here. This is the spinal cord or the nerves. This is the actual joints, and this is the ligament. Any of this, if it grows in, it can narrow the area and cause you to have the pain and discomfort. So now, how do we treat this condition? How do we make the diagnosis? Well, first we got to know who's at risk. Anybody over the age of 50 is generally when it starts. Young people, if congenitally or from birth it was narrow, it's a problem for us. And all those individuals can have pain. We'll be right back. We're going to discuss the anatomy. We're going to see an exam on a patient of mine and talk about what we see in this kind of condition. And then we'll also talk about the MRI. What do you see on the MRI? How do you make the diagnosis? And then we'll talk about treatment. This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
I have pain and muscle spasms to my neck, which develops into headaches many times. When I have pain, I reach for Dr. Carrasco's pain cream rather than a pill because I don't want to take a lot of medication. I use Dr. Carrasco's pain cream as soon as I start to get a headache. It helps me get through my workday better. It works. It really works.
I have shoulder and neck pain. I get to work every day on my motorcycle. Before I go on my motorcycle ride, I like to put Dr. Carrasco's pain cream. It tends to alleviate some of that pain and makes my ride a little more enjoyable. I'm a rehab tech, and I get the chance to see different patients with different types of pain. Right before we start the exercises, we like to use Dr. Carrasco's pain cream. Many of our patients say that they feel much better and muscles are less tight. They love it because it works.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com. Welcome back. I'm Dr. Carrasco. We're talking about canal stenosis, a painful condition that can affect millions of people. So let's talk about the anatomy. The first thing we're going to look at is anatomy, then we'll do a physical exam on a patient of mine, then we'll talk about the diagnostic tools or MRIs and x-rays, etc. Okay, let's get you oriented. This is the lower part of the spine, right in here, all right? And we're going to take this spine, and we're going to flip it like this, and we're talking about this area of the canal, all right? That's what we see here. So what's happening is that anything that's narrow in this space, whether it's a ligament back here, whether it's going to be these joints that grow in this area called facet joints, or the disc bulges out, narrowing of the canal means that it's called spinal canal stenosis. That causes pressure on the spine and causes pain in the back and down the buttock. I want to spend some time with Tina. Tina's a patient of mine who we've seen in the past with the same kind of condition. Tina, welcome.
Thank you, doctor.
Listen, I think it's better that if a patient talks about it than if I talk about it.
Well,
So tell me, when you first came to see me, you were using a cane?
that's right.
You were having pain. Tell me about that a little bit.
Well, I found that it was very difficult to walk without experiencing pain, and the cane helped. And I tried different measures, and finally I came to you.
One thing I didn't like was that cane. A young, smart, intelligent person. How did you let yourself get to the point where you're using a cane? I mean, how did you get there?
Well, I found that it relieved some of the pressure.
But why didn't you get help before that? I mean, you weren't using a cane before.
I guess I didn't. I didn't
You
know.
just adjust to it, right?
Yes.
Unfortunately, we see it a lot. A lot of patients adjust to the condition, and they start using a cane or a walker or whatever they can to function.
I was told that I had to just live with it.
Well, you don't.
Okay.
You know that. You came to see me. What did I say?
You don't have to live with the pain.
You don't have to live with the pain. You're not going to have to live with the pain. So let's talk a little bit about your exam.
Okay.
Now you're not on a cane.
No.
You're doing pretty decent. Let's get you to stand up. Let's see how you're walking around here. Just walk right over there a little bit. All right? You're walking pretty normal. Turn around for me. All right? Nice and straight. So in the office, we would have you walk. We'd do an exam on your back. When you had pain, you had to kind of hear it in the buttocks. Is that right?
Right.
And going down the legs.
Yes.
Okay? All right. Now let's sit right here. Because I think what people want to do at home, you want to know whether you have this condition and what symptoms. First of all, if you stood for any period of time, it caused pain.
That's right.
It would relieve when you sat down. Is that correct?
Right.
All right. Now lay back for me, please. Let's see what you got. People always want to know what's causing their pain. With people who have this kind of condition, this straight leg raise, I can lift your leg, no pain?
No.
None at all, right? Remember, with sciatica, it would stretch the nerve and cause pain. How about this one?
No.
Nothing there. So we see that a lot as patients, that they have this condition. You can go at home, lift your legs up at home. Go ahead and do that for me, Tina. Go ahead and lift your legs up yourself. Hold it up with your arms there. Good, good. Now let's do the other one. All right. If you can do this, you probably do not have sciatica, but you may have this condition called canal stenosis. Okay, sit up for me, please. This is kind of a blow-up of that. And so this is an MRI with someone with canal stenosis. These are the discs in here. These are the bones. And we see right in here. That disc bulges out, and it causes this space to be much more narrow than it is up here. It can cause pain and discomfort down the back and down the buttocks. So we come back, we're going to talk about treatment. So we want to teach you something you could do at home. And I want you to do 10 of these. Take a little break for about a minute and do 10 more. Do that twice a day. This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
The Carrasco Pain Institute was established in 1992 by Dr. Arnulfo Tarín Carrasco and is housed in a beautiful 16,000 square foot hacienda located in the prestigious South Texas Medical Center in San Antonio, Texas. The Institute is staffed with caring and compassionate medical professionals, and the on-site surgical suite is state-of-the-art, equipped with the latest imaging technology. Our rehabilitation department helps patients return to a more productive, satisfying, and independent lifestyle. The medical spa provides a beautiful and relaxing environment, promoting health, hope, and healing. Our in-house studio is home to the Emmy Award-winning Dr. Carrasco Show. We We invite you to visit us at carrascopaininstitute.com or call 210-614-4825.
Welcome back. I'm Dr. Carrasco. We're talking about canal stenosis. We now know what the diagnosis is and how the diagnosis is made. Let's talk about treatment. Everybody wants to know, how do you treat this condition? Well, there are several ways to treat it. One is with medications. We can use therapy. We can use injections, sometimes even surgery. Let's start with medications. Anti-inflammatory medications to stop the inflammation. Muscle relaxers to stop the muscle spasms. Sometimes we have to use pain medications. We don't like to all the time, but when they have so much pain, it's indicated, and we use it in very small doses, 2 or 3 times a day as needed. Equally important, though, we want to talk about therapy. We want to talk about strength and endurance, maintaining the flexibility and stability, and improving your balance. So once again, we have Tina here, who's going to talk about a gait and balance program. Tina?
Yes.
Remember when you were having this kind of condition, you were having a lot of pain, you had some weakness in the legs?
That's right.
All right. They develop weakness in the legs because they're not being active, all right? So we want to teach you something you could do at home. Just find a chair on the couch or whatever. You'll find out where I'm going with that in a little bit. But we want to talk about how to strengthen these thighs so you can get out of the chair. We want your legs evenly spaced out, all right? At first, we want to push off with the hands, but later on, we want to not use our hands. That'll develop strength. You feel it in the thighs here?
Oh, yes.
Okay. That's what we want to do. Remember going from the tall chair to the low chair?
That's right.
All right. Legs kind of evenly spread. Push up in front of you, then sit back down slowly. All right? Now, that's the easy one. Tina, let's talk about the chair now. As you feel like you're getting better, then you may want to go to a lower chair, which becomes harder, as you can imagine, when you stand up. Stand up for me again there. Again, your legs evenly spread apart. Put your hands in front of you, away from the body a little bit, away from the body more. Sit back down for me one more time. And I want you to do 10 of these. Take a little break for about a minute and do 10 more. Do that twice a day. So you should do 20 in the morning, 20 in the afternoon. And as you're getting stronger, you'll go to a lower stool or a lower chair, all right? We're talking about strengthening, but it's also important to talk about a gait and balance program. Tina, here we go again. You ready?
Yes.
All right. And we used to do these also where you had to stand on this foam cushion, and it gives you kind of not so stable as you are on a regular floor.
Yes.
At home, you can put a pillow down or fold some blankets down so it's not quite as steady. All right? What we want to do here is hold on to something. It could be your couch or a chair at home, something with stability. Right? And I want you to show us what you do. Stand on one leg. At first, hold on with one if you need to. Do it again. Good. Then slowly just lift it up till you feel confident. All right? All right, let's try the other one now. All right, hey, that's pretty good on that leg.
Yeah.
All right, let's do the other one now. Okay. All right, when you do each one of these exercises, we want to go for about 45 seconds to a minute, and then take a break, and then do the same thing. I want you to do 10 on each side in the morning and 10 in the afternoon. Let's talk about now an actual treatment that we use. We did it on Tina herself. Tina, remember that injection?
Absolutely.
All right. It's called an epidural steroid injection. In a sterile environment, we want to first numb up the area. And our goal is to try to do the injection by placing a needle, again, in the epidural space, not into the spinal canal, but right into the epidural space outside the spinal canal. We want to confirm that it's in the right location. Once we do that, we want to inject some dye or some contrast material to ensure that it's where we want it to be and not into the spinal canal itself. Once we do that, then we inject the steroids, this kind of white material you see here, and we inject 60 to 80 milligrams depending on the patient to give them the relief that they need. Then we inject the muscles. The areas that were kind of tender, we inject those also. Tina, you remember that injection?
I do.
What do you remember about it?
I remember that I asked you if you had started, and you said, we're already finished.
Okay. Well, it's a pretty simple injection.
Yes.
All right. Any questions you have about those?
But I didn't feel anything, and I was wondering, why is it that we don't feel, because that's a pretty big needle, and it's going pretty far down.
Well, if you remember, the first needle we gave was to numb the skin. That way you wouldn't feel it on the way in. And really, the most sensitive area is the actual, the skin itself.
Okay.
We're going to do 2 injections on a patient and get some of the inflammation under control. If the pain goes away, we stop with 2. In some cases, I think in your case, we had to do 3 injections. That should last 6 to 8 months, a year, maybe even longer in many patients. Let's talk about surgery. When is surgery indicated? Sometimes the steroids don't help you, the therapy doesn't help you, the medications aren't helping. And if you have prolonged numbness, weakness, atrophy of the muscles, we've got to think about surgery, but that's pretty rare. We'll be right back. Let's take the next question. Taking too much anti-inflammatory meds could primarily lead to damage of which organ? Is it A, the kidney, B, the liver, or C, the gallbladder? Shyla, what do you think?
You don't want your kidneys to be inflamed?
This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
I got hurt at work by typing, and I was not able to use my fingers anymore. I've been going through a lot of therapy and surgeries, and I have lived in a lot of severe pain for many years. I carry Dr. Carrasco pain cream inside my purse. So I'm able to use my hand to open the door, unlock the door, where before I couldn't do. Everything was done by my left hand. Thanks to Dr. Carrasco pain cream, I'm able to do all that. And maybe in time I'll be able to use my hand 100%. And I'm happy, I feel alive, I feel like my hand has been reborn. And as soon as I started feeling the pain again, I'll just go ahead and use Dr. Carrasco pain cream, and the pain goes away within 35 to an hour. So I come in today to see Dr. Carrasco to tell him how happy and how awesome it is that he created this pain cream.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com. Welcome to Medical Challenge, where we find out, do you really know medicine? Let's meet our contestants.
Yes, my name is Shayla. I am originally from Abilene, Texas, just relocated to San Antonio about a year ago. I plan on pursuing a master's degree in healthcare business administration.
Oh, my name is Guillermo. I'm from Puerto Rican descent. I am currently pursuing a bachelor's degree in physical therapy.
My name is Marty Peña. I just recently got married about a year ago, and we're very happy. We're originally from Brownsville, Texas.
Here's the point system. A correct answer gives you 10 points. It's really simple, multiple choice, A, B, or C. Give me the best answer for the question. All right, let's take the first question. What is the name of the muscle located in front of the upper leg? Is it A, the quadriceps, B, the hamstring, or C, the pectoralis? What is the name of the muscle located in the front of the upper leg? Is it A, the quadriceps, B, the hamstrings, or C, the pectoralis? Shyla, what do you think? You say the answer is B, hamstring. Why?
Because I'm wrong.
Okay, did you try to get it right? Or?
Yes, I did try to get it right, and I realized it after I picked B.
What do you think it is?
I think it's A.
Think it's A? All right. Did you look at Guillermo?
No.
All right. Guillermo, she thinks it's A. What do you think?
I'd have to go with quadriceps A. The hamstrings are going to be located on the bottom portion of the leg, behind the calf.
Okay.
And of course, you have the pectoralis muscle, which is going to be up here in the chest.
Marty, you say A. Why do you say A?
Yes, sir. They're located in front of the leg, in the upper part of the leg.
Okay. How many muscles front of the leg?
Well, 4.
Well, the answer is quadriceps. The answer is quadriceps. Let's take the next question. Ligaments in your body attach which structures to each other? Is it A, muscles to muscles, B, bones to bones, or C, muscles to bones? The ligaments in your body attach which structures to each other? A, muscles to muscles, B, bones to bones, or C, muscles to bones? Shyla, what do you think?
I think your ligaments are what are actually holding your muscles together.
Okay. Guillermo, what do you think?
I chose C, muscles to bones.
Guillermo, are you sure about that?
No, it's actually B, because I'm
think
thinking
so?
of tendons is the answer is C. So B is actually the correct answer.
Marty, you said B. Everybody's got a different answer. Either you're right or you're wrong.
Yes, I believe I am right.
Tell me why.
They connect bones to bones.
Okay. The answer is B, bones to bones. Bones to bones. That's all right. Let's take the next question. Taking too much anti-inflammatory meds could primarily lead to damage of which organ? Is it A, the kidney, B, the liver, or C, the gallbladder? Taking too many anti-inflammatory meds could primarily lead to damage of which organ? Is it A, the kidney, B, the liver, or C, the gallbladder? Guillermo, what do you think?
I chose B, the liver.
Why?
Taking in any type of prolonged medication can actually affect both the kidneys and the liver, but the liver is going to receive most of the damage from constant use of medications.
All right, Marty, what do you think?
I just heard my professor say, when in doubt, choose liver. So I chose liver.
What? Like, what do you want to eat tonight? Liver?
Liver.
Yeah.
Done.
Okay. Shayla?
I would say because you don't want your kidneys to be inflamed.
You don't want your liver to be inflamed either.
Yeah.
So you're going to go with kidney?
I'm going to stick to what he said because he sounds like he knows what he's saying. But
he says B.
I know.
No, you're going to stay with A or B? B? All right, well, everybody said B. Either you're all right or you're all wrong. The answer is A, kidney. The next question. When a prescription is written as take 1 tablet BID, it should be taken how many times per day? Is it A, once per day, B, 2 times per day, or C, 3 times per day? When a prescription is written as take 1 tablet BID, it should be taken how many times per day? Is it A, once per day, B, 2 times per day, or C, 3 times per day? Marty, what do you think? You said B.
Twice a day.
Twice a day. Why?
BID. It's usually a medical abbreviation for twice daily.
Okay. And Shyla, you're a medical collector. Do you see those words at all?
I don't see those words in medical collecting, but I would just take something once a day if I'm not sure what it means.
So no matter what the prescription says, you just do what you want to do.
And I'll call my doctor and ask him after.
Okay. All right. Guillermo, you say once a day?
I said once a day. Unfortunately, in my profession, I don't get to write a lot of prescriptions, so I don't
Are you a
run
doctor?
across. Not at all.
You don't
So
write
I
any
I don't
prescriptions?
write any prescriptions.
Okay, good.
So unfortunately, I don't run across the abbreviation BID quite often.
So you're going to say once a day?
I'd have to go with once a day.
Right? The answer is 2 times per day. 2 times per day, Dr. Guillermo. Twice a day. Next, the spelling bee. Shayla, we gave you those 10 points because you kind of had them. So we got 10 points. Guillermo, you got 10. Marty, you have 30. You can bet as many points as you want. All right? If you can spell this word correctly, you get to double the points. If you miss it, you lose that many points. Shayla, how much you want to bet?
10.
You want to bet all 10? Okay. Guillermo?
I'll go with 10.
You're going to bet all 10. And Marty, how much you want to bet?
Let's do 25.
25 points. Okay, here we go. Kate, go ahead and give them the choices. Now, since you're betting the most, you get to choose the word that all 3 of you have to spell. All right? Can you spell the word piriformis? The piriformis is a muscle that sits right behind the sciatic nerve. All right, well, here's how you spell it. Piriformis. Shayla, we're sorry. You almost spelled Puerto Rico, really. It's okay, hang in there. We had a lot of fun here today. Shyla, unfortunately, you lose your points. You get 0 points. Guillermo, you get 10 more points, or 20. And then Marty, you're our winner today, 55 points. Thank you so much for playing. Congratulations. When we come back, we're going to talk about lifestyle, home remedies, and how to treat this condition long term. We'll be right back.
The Carrasco Pain Institute was established in 1992 by Dr. Arnulfo Tarin Carrasco and is housed in a beautiful 16,000 square foot hacienda located in the prestigious South Texas Medical Center in San Antonio, Texas. The Institute is staffed with caring and compassionate medical professionals, and the on-site surgical suite is state-of-the-art, equipped with the latest imaging technology. Our rehabilitation department helps patients return to a more productive, satisfying, and independent lifestyle. The medical spa provides a beautiful and relaxing environment, promoting health, hope, and healing. Our in-house studio is home to the Emmy Award-winning Dr. Carrasco Show. We invite you to visit us at carrascopaininstitute.com or call 210-614-4825.
This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
Welcome back. I'm Dr. Carrasco. We'll be talking about canal stenosis. Let's talk about lifestyle and home remedies. What can be done for this situation? Well, pain relievers, take them when you need them, especially during times of flare-ups. Sometimes the weather changes and your pain gets worse. Sometimes you have increased activity and that makes it worse. Take your medication for 2 to 3 days to get your pain under control. Do your exercise that we mentioned today. And don't forget to use a cane or walker only when necessary. Now, this is a chronic condition. It's not going to go away. We didn't do surgery to treat this problem. So we need to treat it when it flares up. If you're going to go on vacation, please prepare. Just like you do your suitcases and everything else you're taking, prepare your medications. Make sure you have plenty of medications to cover the amount of time you're going to be gone. When you have this condition, it impacts your life. It impacts your whole family. If your husband or your loved one or a friend or a neighbor has this condition, please get help. It can be easily treated and can improve your quality of life. I'm Dr. Carrasco, and I wish you a life full of health, hope, and healing. God bless you till next time.
This has been a Carrasco Media Group production. Thank you for watching.
For more information and videos regarding painful conditions, visit our website at CarrascoPainInstitute.com and drcarrascoshow.com. And I invite you to like, subscribe, and leave your comment.